Following surgery, the patient will be directed to a specialist orthopaedic ward where a team of specialized nurses, physiotherapists, occupational therapists, etc. will take care of the post-operative management. Our ultimate goal is the return of the patient to their pre-injury residential place.
So post-operatively, I will see you on the ward, any ward that you're on, either trauma, orthopaedic or surgery. And the main aim post-operatively is to get you to eat, drink, stop the fluids, get you into the chair, interacting as much as possible. And at that point, we're thinking about what your functional baseline is, and we want to get you back to where you were.
We have a daily MDT where we would discuss the ongoing care needs from the medical staff that's needed. And also start discharge planning as well, liaising with family. Once stable, the therapy team will become involved in your loved one's care.
We recognise that all patients that have had a fracture and decaphremia would have increased energy requirements. We'd look at what they're in with, what their nutritional needs are as a result of their fracture. We would then assess what they're managing to eat on the ward and any measures we need to put in place to ensure that it's sufficient so that their wound post-surgery can heal well.
Hi, my name's Ryan and I am a physiotherapist. We'll see your loved one once they're on the ward and they've had their surgery. We will assess their movement, so we'll assess how that lower limb range of movement, so how much movement they've got in the hip, also their muscle power. From there we'll look at getting the patient up, getting the loved one up and getting them mobile again. So initially that might be just transferring to a chair, and then from there we'll gradually progress and try and cover a bit more of a distance.
Hi, my name's Crystal and I'm a therapy support worker. For an occupational therapist, we will mainly have more contact with yourself or loved one towards the end of the hospital stay. We will look at making you independent, have a look at you getting in and out of bed, on and off the toilet, how you shower and how you would wash and dress yourself, and whether you'd need any equipment or any support at home on discharge to make you as independent as possible.
On discharge from the hospital, it may be that we refer your loved one for ongoing physio input, so that may be in the community and they'll visit them in the home, or that may be as an outpatient in an outpatient facility.
If required, not always, we will do a home visit for yourself or a loved one to ascertain whether the equipment may fit into the property. Those equipment may tend to be that for those patients who are struggling a bit more with their mobility and their transfers from bed to chair, for example, and whether they need things like hospital beds, hoists, SARA steadies. So those equipment are quite big pieces of equipment, and we sometimes need to do site visits to ascertain whether those pieces of equipment will fit into the property for you to then go home.